Assalamu alaikum wa rahmatullahi wa barakatuh. A very good day to you. Welcome to another edition of Life Matters, where every life matters. Stay with me for the next hour or so as we elaborate into the impactful initiative shaping communities. Remember, you can interact with us, so tell us your story. That makes your life matter and life matters around you. We'd love to hear from you. Any comments, questions, or queries, you can send that through to our social pages, our email, and our WhatsApp as well. Today, we're thrilled to spotlight a remarkable doula training program, pioneering by experienced doula Sadiyah and general practitioner Dr. Nabeel Adam. Join us as we explore their collaborative effort to empower individuals in providing compassionate support during the journey of childbirth rather. So please stay tuned, and remember, we would like to hear from you as well. So if you have any questions or comments, do send them through. Let's welcome our guests. Assalamu alaikum to you, Dr. Nabeel and Sadiyah.
Walaikum salam. How are you?
Good, shukr, alhamdulillah. Welcome back to our studios. We've changed it a little bit. So
bit more fancy
Yeah.
than what it was.
Thank you. And Sadiyah, finally having you in the studio. I know we were chatting about getting you into the studio for a while, but you've just been busy catching babies.
Yes, yeah.
Welcome, guys. And Dr. Nabeel, you've been working with Sadiyah for a while, and we're going to hear the story how you pushed this initiative brilliantly to, year for us now to bring about it to our viewers as well. So let's deal with firstly, Sadiyah. I mean, people hear this word doula. What is a doula, and what do they do actually?
So a doula is a non-medical professional that assists women before, during, and after childbirth.
Okay.
So we have different types of doulas. So we have a prenatal doula, we have a birth doula, and then we have a postnatal doula. So if you look at the history of what a doula actually is, you find that it goes back very, very far as to how our great-grandmothers birthed and so forth, where there was no medical intervention. They just stayed at home, knew that they were pregnant, no prenatal consultations, no scans, no sort of medical intervention. And then when it was time for them to birth, they would call someone from the community, a lady or midwife from the community, come over, deliver her baby, see to her for like 10 days or 40 days after birth. So if you look into the history of that, of how women used to birth a long time ago, with the help and with the assistance of other women in the community or from the community that had the know-how on birth and postpartum and how to deal with postpartum, etc., you find that's exactly what a doula is. So she's there to assist you and not take the place of your partner, of your husband, of your medical practitioner, of your gynecologist, midwife. It's just, it's a different entity. It's a completely different person that's there specifically to give the mom that ongoing positive support to help her have a good positive birth outcome.
So it's an additional birthing partner.
Yes,
I would say,
so it's an additional, it's specifically there for the mum, but we find that we also assist the dads because a lot of the times the dads are very ill-equipped with the whole process of labor and birth and postpartum and how to deal with the new mom during the postpartum period, etc. And we find that the doulas are there to sort of keep everything together. When the dad is sort of losing his mind and he's like, okay, why is my wife behaving like this? I can't understand why she's crying. She just had a baby. We're all happy. We should be happy. And then the doula is there to sort of explain and say, okay, it's completely normal. She's just had a baby. Her hormones are all over the show. She's going to be like this for the next 6 weeks. This is what you can do to help the process, to help her ease into motherhood, etc. So we're not just there for the mum, but we're there for the dad as well. And then to sort of help them cope with their new baby, adjusting, adapting. I always say, when a baby is born, a mother is also born. She never existed as a mother. So as much love and attention that we give to the new baby, we should be giving the same love, attention, and care to the new mother because she's just as new as that new baby. And this is where I find that the support when it comes to postpartum mothers and that are not very it's not very like well looked upon. And this is why postpartum doulas are so important and play such a vital role in the mom managing her process into motherhood.
So Dr. Nabeel, as a general practitioner, what would you say? What opportunities are there available for doulas in the industry of medicine?
So I think they have like a wide source of opportunities now because it's becoming more popular as a doula, because gynecologists are now referring doulas to the patients. Right? Because it's now becoming a popular thing and a service that's
available,
required basically, because it's much better for a woman to have someone there to support them besides just the husband, because they're always with the husband. So it's a different point of view from someone like a woman. So I think the opportunity is there now for doulas to rise.
Definitely. I must say I had experience of having a doula by my side with one of my births, and it is a need, a definite requirements for moms when the dads are there supportive, but they really don't know what to do. They literally don't. And then we have someone that besides the nurse, besides the midwife, besides the gynecologist, yes, it sounds like there's lots of people in the room now. Then you have this birthing partner, a birthing support partner that actually pushes you to when you need to push or helps you stop when you don't need to push, and that sort of thing. But Sadiyah, if you could tell us, what are the requirements to becoming a doula?
So usually with our students, if they don't have their grade 10 pass, so what we would do is interview the student first to make sure that she's mature enough to be able to deal with birth and deal with postpartum. It's not just about taking on any student to do the course and, go out there and be a doula. So you have to be mentally, physically, and emotionally mature to deal with being at a birth, to be able to support a mom during a birth process. And even if she's just looking into becoming a postpartum doula, she has to have the correct know-how and the correct skill on how to manage and how to deal with a new mom. So ideally, it would be a grade 12 pass, and she doesn't have to have any extra education that she's completed. So it can be for a young girl that's just come out of school, looking for a career path, looking for something to do. Maybe, if she was interested like in the medical field or midwifery field or nursing field and not yet ready to explore, to go in that direction. So this year is a good start, I would say, for young girls, to give them the feel and the sort of know-how and, that gentle experience into like birth, postpartum, prenatal care. Yes, you do a lot during the birth process. I would say you do much more than most of the staff that's, that's at the hospital.
Your eyes are all
see,
over, hey?
So they see to the medical part, and then you see to, the emotional, the mental, the making sure that the mom is okay, making sure that she's breathing correctly, that she's coping and managing so that she can actually get to that 10 centimeters of having to push her baby out. So I think for young girls it's a nice career path. Although we've had a lot of women in our classes, in our training, that's already qualified in certain things, in certain fields, but wanted to venture out or wanted to up their skill or just learn or learn how to deal with people, because it's not just dealing with birth and postpartum and prenatal and all of that. It's also we learn people skills in our training, how to deal with people. So even like a doctor for that matter, sometimes the bedside manner would be, different. So
less desirable.
Yes, So we find that with our training, I actually had a doctor in my class. So and she said, the skill that she picked up with like her people skill. She wasn't taught that in university in her 7 years of becoming a doctor. So even if she just took that from our training, it was good enough and she was pleased.
Brilliant.
So
So we go into more of the course and how long it is, because that's my next question. How long does it take to become a doula? My first train of thought is it's actually a good thing for young girls to do possibly when they take this gap year and they don't know what to do. They want to become mothers. They're going to become mothers one day. So to actually see what's happening with mothers when they're having it, to get that emotional attachment is a good way to start. So we're not taught to become mothers. So doula training, I think, for any mom, in fact, whether they want to become a doula, a birthing partner, a support partner, for that matter, it's actually a great course to do. But we hear more about that from Dr. Nabeel and Sadiyah just after the short break. Do stay with us. Assalamu alaikum and welcome back. This is Life Matters, and we share with you today a doula program that it trains young ladies to become birthing partners for expectant moms. Prenatal, postnatal, wow. So such a wide actually area of expertise that they can go into. And let me tell you that there's some surprising facts that you need to know. So stay tuned. We have Dr. Nabeel in studio with us. Dr. Nabeel Adam is a general practitioner and owner of Doc Med Savvy at Doc Med Savvy, as well as director for the Belly to Baby doula training program. And also guiding us through the training program is Sadiyah, and Sadiyah is a lecturer and a doula herself. So Sadiyah, or at least Doc, if we could come back to you quickly, what would you say are some of the experiences that the doula is involved in that's sort of out of their expertise, that where you guys get involved in?
Well, things with medication and things like that. Obviously, a doula is not really part of the medical side. So doula is more on the emotional, physical, those type of things. So on those type of things, that's where they come in. So with us, it's more on the medical and giving you the basics of what you need to do. That's why the doula is important, to give you that extra bit of information now. Where we lack in. Because as we see there's so many women giving birth then. So that's the thing.
So the doctors are instructing what needs to happen back and forth. And that's scary. That's scary for the mom lying there, Sadiyah, because we understand as much as, they need to get the medical help, they need the advice for the doctor to direct correctly, but they're lying there also in pain and anxious about what's going to happen, what's needing to happen. And then the doula comes in understanding what the doctor is saying and now calmly can explain to the mom. So what would you say is sort of the experience with regards to the doula that does fall out of your scope?
Okay, so like Dr. Adam mentioned, it's the medical aspect. So administering drugs, discussing anything with regards to any medical interventions, etc. Any procedures is not, it's out of the doula scope of practice. So anything that the midwife would do or the doctor would do or the gynecologist would do, the doula is not allowed to do that, is totally out of our scope of practice. So yes, again, we're there for the mental, physical, and emotional aspect of the mom dealing. And also it can't be expected from the gynecologist to come in there and support the mom and start, massaging her or encouraging her or telling her, yes, 1 or 2 words of encouragement, but the gynecologist has so much on their plates. They have so many patients waiting in their rooms for them. So they can't do that. And it can't be expected from them as patients. And this is why women actually take on doulas, because they understand and they know that they're not going to receive that support. Besides, in their prenatal care and making sure that their baby is born safely with, the least amount of intervention, hopefully, without any drugs or having to go in for a C-section or having to go into theatre, etc. So that is the role of their care providers, whereas a doula would support her throughout that process. So whether it's a natural birth, whether it's a C-section, whether it's a hospital birth, whether it's a home birth, your doula is still going to be there. So you can't expect, or a gynecologist doesn't come to a home birth. So it's very different. Their roles are very, very different, and where they would practice or where they could practice. Whereas a doula is a completely different entity, and you're allowed to have at any birthing unit. So be it a midwifery unit, be it a home birth unit, be it a hospital, be it at home. So a doula is always there. She can always be there. There's no like sort of rule as to, how much she can do and how much she can't do with regards to the place that you birth or where you choose to birth, etc.
Yeah. So Doc, what would you say? And of course, you the pioneer behind the Belly to Baby training program. What was the inspiration behind starting this training program for doulas?
I think the main reason is woman empowerment, because there's lots of women that are just sitting, or even girls, or even older ladies that didn't do anything in their lives. So now they're looking for something to empower themselves.
Okay.
And also it helps doctors, husbands. So you're not just associated with the woman alone. You're associated with the whole family. And you're helping the doctors, and you're helping the lady, the father, the other kids.
Doc is mentioning dads and fathers. Are they included in this training program, Sadiyah?
So, not really. No.
What if they want to come?
They're welcome to, but there's lots of
Is there certain
interesting
criteria, that men just not fall under?
I don't think men...
They're
already tired. That's why they get a doula to take care of because they can't handle it by themselves.
Yeah.
And I don't think like a woman would be comfortable with another guy.
No, but I mean the husband, the husband,
yeah.
for instance. If he's like, no, I want to be there, I want to support my wife, I want to be her doula.
And this is
Don't
why
laugh,
we have,
Nabeel.
this is why we have antenatal classes,
The antenatal,
They must
okay.
attend antenatal
Yeah,
classes.
that's
They don't have to do like a whole doula
Yeah, they don't
training,
have to do the
a
whole
5
doula
intensive
training.
course
Okay.
just to know.
Okay.
So I think, yeah.
All right. Okay, that establishes that for female. I think at the beginning when I said for young girls, and the surprising fact is the duration of this course, which I want to get to as well, is for young girls, whether they are teenagers and they want to experience. I mean, I think she was 14-year-old with one of my babies. She wanted to be there. And I was like, no, my girl, you don't want to be there. And she was convinced, like, no, I want to help you, I want to support you, mommy. But with when she was there that night and all the craziness being around, I mean, I don't know if that's ideal for 14, 15-year-old to go through the doula training program. But sort of to understand that where she was coming from, to support her mom, to be there for her mom, to see what's happening as well behind the scenes. But, and that's what I want to get to, is that as young girls, to have this information to equip us for later years is actually a resource that nobody's going to teach us. So for you, Sadiyah, I want to get into quickly with Dr. Nabeel introducing this, saying, because I think that's how it started, Doc.
Yeah.
Let's tell the story quickly. Besides the inspiration.
She's a doula for 15 years.
Yeah.
So she has that amount of experience and
Yeah.
stuff to handle this. So she was the best woman for the job to bring our new doulas into the world.
So you approached her
Yeah.
and said, I mean, okay, you guys have been working for a long time.
Yeah.
Even when we did that, the show previously, I knew Sadiyah was in the background. I knew she was a doula. I've been trying to get her to come into studio to talk about, doulaing and, birthing and stuff. So you approached her, and this was something that you had to think about. Sadiyah, tell us quickly, what was your first reaction when Dr. Nabeel said, listen, let's do a training program?
So initially I thought, okay, no, you're crazy, because my schedule. I don't even have time to drink water sometimes because I'm a prenatal doula, birth doula, and postnatal doula. And obviously managing my family life, my home life, my professional life. I'm a lecturer as well at a college. I'm a lecturer for ECD. So I thought, okay, it sounds like a good idea. I have the know-how on how to do it, but I just needed that nudge from him, and then he convinced me, and all the pros and more, and there was no cons when he was discussing this. And
I'm sure he convinced you that
he did.
that
He did convince me. It didn't take him very, very long though.
Okay.
And yeah, alhamdulillah, we curated this course together. The entire manual we set and we did together. So it was lots of intensive work to go into it, and then our practical work that goes with the course as well, the after, the mentoring of our students. So it's a lot, it's taken a lot out of us in the past few weeks, but alhamdulillah, it's been a complete success. And yeah,
Well,
I'm
you
happy.
said yes, and the rest is history. Talk about who should enroll in this course, Dr. Nabeel.
I think anyone should enroll who wants to look for a new career opportunity, because it's literally a whole career.
Yeah.
It's not just a short course where you can, if you're bored, you can just do something. It's literally like a whole career, becoming like a doctor or a lawyer or something like that. It's just obviously not on the medical directly, but it's also part of it, because when you go to the hospital, you're still there with the doctors, with the midwives, and everyone is there with you. So for looking for a new career, I think everyone should be doing it, whether you... So for the younger ones, obviously we have to look at emotional maturity, if they are. And then any age is possible, because as long as you fit enough and ready for
matured enough.
Yeah, matured enough and ready for the challenge, and I guess you should be doing it.
And of course, open to all women and all young girls, Sadiyah. We need to quickly pay the bills, and when we come back, we'll look into who should enroll for this course, who is this course specifically formulated for, and the surprising fact is how long this training is for, the intense one-on-one with the doula, with Sadiyah said, as well as Dr. Nabeel, who is the brain behind this, at least pushed Sadiyah to do more. After 15 years as a doula, as a lecturer in ECD as well, they join us here in studio to talk more about this Baby to Bella doula training course, more just after this. Welcome back to our Belly to Baby doula training program, as we're chatting to Sadiyah Sayed, a doula herself for 15 years and lecturer of ECD, and Dr. Nabeel Adam, who is the owner of Doc Med Savvy, as well as the director for the Belly to Baby doula training. And apparently it's open to everyone except dads. Apparently. It's still to be questioned. So Sadiyah, I want to look at now to understand how long this course is for, who exactly can register for this course. As I said, except dads, but we'll argue about that point later. Who exactly can register for that, for this doula training course specifically, and how long is it?
Okay, so anybody looking to start a new career path, so whether you're fresh out of school, if you've done any sort of like university studies, anybody that would like to equip themselves with the skill on how to assist mums during labor, postpartum, prenatal, breastfeeding, etc., or even just for a new mum, someone becoming a new mum, and learn the skill on how to manage her entire labor process, her birth process, her postpartum process, how to manage her baby, how to learn to breastfeed her baby, etc. So it's open to anybody that's interested in that field, where it comes to prenatal, postnatal, birth, babies, etc. If you have if you have a liking for that sort of field, even with regards to hospitals, you have to be susceptible to that kind of environment, that kind of setting, etc. And our course is our 5-day intensive course, face-to-face course, where I do the lecturing. So it's from 9 to 5 every day. And then thereafter, after you're done with that course, with the face-to-face course, we allow every student a year, because we have practical and theory work that each student needs to complete. So Nabeel and I mentor all our students with that regard to finishing and getting towards their certification. So there's births that they have to attend in different settings, like home births, hospital births, C-sections, etc. That would be like their practical work. And then they have to do courses on breastfeeding, antenatal classes. So ongoing education. They have to complete a certain amount of ongoing education, and then they have theory work. So their theory work is books that they have to read, do their book reviews, etc. And then we allow them a year only. After a year, they have to book for the exam, write the exam, and then if they pass, then they would be certified doulas In the meantime, they can practice as student doulas, but obviously under a professional doula.
Okay.
So if they're attending a birth, it would probably have to be with me or one of my colleagues, etc. Come in as a student doula to shadow us, to view what the birth is about, how to conduct yourself at a birth, etc. Even for prenatal consultation, postnatal consultation. So they're not allowed to go in on their own and just start practicing. No, as students. So they would go in as a student doula, but shadowing a professional doula, a certified qualified doula. So it's a 5-day intensive course, and then we allow them a year, and then they have to write the exam, certify hopefully, and then all our doulas are registered with DOSA, which is Doulas of South Africa. So it's an umbrella of doulas where then you sort of get like a registration number, and then when you are practicing doula, you then claim from certain medical aids for your, yes. So there's medical aids that cover doula fees.
Okay.
So initially, when I started 15 years ago, there was only 2 medical aids that covered my fees, and now there's about 6 medical aids that actually have found the benefit of having doulas and how many people are using doulas at their births and postnatal care and for their antenatal classes, etc. So they've become more open to it, which does help, you know, in the whole doula community with, and obviously people having to hire more doulas for their births and for postpartum care because their medical aids are covering a certain portion of our fee. So when the doulas certify from our training, they then would be registered with DOSA. We will make sure that all our doulas are certified with DOSA. Currently, we're also trying to get our training to be certified and recognized overseas.
Okay.
So if our doulas would like to go and practice abroad, we almost there with that regard to having our course certified overseas. So inshallah soon, where our doulas can then use our training.
A definite age-old profession that has come back in the 20th century. Dr. Nabeel, thanks for that. What makes this program different, this doula training, belly to baby doula training program different to other doula training programs?
I think we have the best lecturer first. So 15 years of experience is a lot. I think experience is the main thing in this field, well, in any field. So that's the first thing. I think it's important when we set a course that's not missing a single thing that a student would require to become the best doula possible. So we have like extra courses, like such as there's certain courses, there are doula courses that are around, but we've like included a very intensive one. And also with the mentorship and with certain types of subjects like rebozo, which you wouldn't find in other ones. There's also introduction to breastfeeding. There's a lot of other techniques, acupuncture, things like that, that's used in this. So the course has a lot of work in it that will make you...
Sort of a holistic approach.
Yeah.
Where is this training taking place, Doc?
In Melville at the Professional Child Care College.
Okay. And who has attended? Sadiyah has mentioned, you know, she's even had a doctor. So besides those that she's explained who can attend, what is your recommendation on those that can attend?
So anyone can attend the course usually. So we have like a few guest speakers. We have a midwife that came in to speak. We have a breast specialist that came in to come and speak for us. And there's also myself that went to give a talk. So we have a lot of people that are guest speakers and giving them more experience into becoming in the world of the medical field and to become a doula.
What would you say as a medical doctor? How would this enhance you as a general practitioner or within the medical industry for other medical doctors to participate in? How would this enhance your skills?
I think people would become a bit more sympathetic and emotional, because as a doctor, you just switch off because there's a lot of patients coming in and you're like tired, but you obviously have to like, especially if you work in a hospital environment where you don't get to sleep when you're on call and stuff like that. You obviously tired, you have no energy to be empathetic towards other patients sometimes, so it becomes a bit difficult. So this helps you a bit to deal emotionally and to have that support. And it shows you how important that support is, especially with something like postpartum depression. So a lot of women go through it, but they don't even know they're going through it.
Yeah.
And obviously, as a spouse or someone around you in your family, they wouldn't know what's happening to you because you're not really speaking about it. So a doula would come in and be able to support you still in that postpartum phase and be able to pick up on certain things. Whereas the doctor doesn't have time to go and baby you.
Yeah, they're in and
those
out,
words.
literally.
Yeah.
I love the idea that you were a prenatal doula, a postnatal doula, and as well, the current birth doula. And I'm sure, that's a show on its own. But I want to talk about possible ways that you incorporate maybe sort of cultural sensitivities and people's different mannerisms and even their temperaments. How does this doula training incorporate inclusivity? Because as Muslims, we have a certain culture. As non-Muslims, we don't, and the same with the African culture.
So this is actually a very important topic that's in our training, is to become accepting of every single culture, to become accepting of every single patient that you're going to be dealing with, that you're going to be managing. So it's about being open. We can't walk into a birth or have a birth plan. So we always have a birth plan. We always recommend for a patient to have a birth plan. So they would put their birth plan on paper, and then we would discuss it with them. And we always have to be open. So there's certain things from different cultures that different people want. And we can't say, okay, no, we don't do this, or we don't do that, or we're not. This is why we discuss the birth plan. So if you as a doula, you're not comfortable, this is where it has to be told. This is where it has to be said in your prenatal consultation. Not go through the entire pregnancy, labor process, and then decide at the birth, okay, I'm not comfortable doing this. So it's about being impeccable with your word, being honest, being open, how you practice as a doula, what you're open to, what you also respecting yourself and your values as a person. So if it's something that doesn't sit well with you as a person, you would say, okay, I don't agree to this, or it doesn't sit well with me, or I'm not comfortable doing this. Is there something else? Or, so it's always being impeccable with your word when being a doula. Be honest, be straightforward, but also showing a lot of empathy, like Nabeel said, like doctors don't have the time to show that empathy towards patients. So show that empathy towards them. Be open and be accepting of different cultures, different types of people. You get to meet all sorts of people. In the 15 years that I've practiced, I've literally gone from overseas, practicing overseas, seeing postnatal patients overseas, to literally like in the scariest of places where I thought I was gonna get like hijacked or something, but it's what was required of me as a doula. So not every day is the same. Not every patient is going to be the same. You're not going to have good days. You're going to have bad days. You're going to feel like this burnout, creeping up on you. But it's about managing yourself as a doula and respecting your principles as a doula and saying, okay, this is okay. I'm okay with this. I'm not okay with that. And being open about the type of practice that you're going to have. And I find that it can be a very, very successful practice if you stick to your grounds and
It sounds like a calling. So we'll discuss more with regards to belly to baby doula training with Sadiyah Said and Dr. Nabeel Adam just after the short break. Stay with us. Welcome back. In this health edition of Life Matters, we're discussing a doula training program called Belly to Baby. We have in studio with us Sadiyah Said, ECD lecturer, 15 years of doula experience, as well as Dr. Nabeel Adam, who has initiated this beautiful process to empower women of all ages. Dr. Nabeel is also the owner of @DocMedSavvy and director for the Belly to Baby doula training. So I think, Doc, as someone that runs a business that needs to somehow look at the end margin, With regards to doula and being a doula as a profession, would you say that this is a profitable career at all?
I think it definitely could be a profitable career. It just depends on how you approach the situation and how much of work you get done. So I think it all depends on the person. If you're a hardworking individual, it's a very profitable
And
career.
if it's something that, listen, I'm not going in this for the money.
Yeah.
Does that often happen?
Well, you shouldn't go into any career just
Yeah.
looking for money.
Yeah.
I know money is definitely important, but I mean, you can never go into a career just based on money because you'll be unhappy your whole life. You'll be going upset to work every day, especially with medical type of jobs or this type of job. You need to be at your best for the person. So because you have to be very empathetic, emotional.
Yeah.
So if you're going through a bad time, you have to put that aside and put yourself for and be there for them. So that's why I say it's very important. Put money away, even though it's profitable, and it just depends on how you run your doula business and stuff like that. But I think it's definitely profitable. But the main thing is that you should be loving kids. You should be loving people because you're going to be interacting with mothers, fathers, grandparents. There's a lot of people to be interacting with, and there's lots of questions, and so everyone wants to know a lot of things. So you're just there to support. So I think it's important that you actually need to love a lot of people and babies.
So you've known Sadiyah for a long time, and this is something, I think, doula, teaching, nursing, any career that allows you to be interactive with individuals on a personal level, it's a calling. So what would you say to an individual when you want to sort of encourage something like this for them? Because, of course, it's open to everyone. And I think, personally, all girls should do this. If they plan to have a family and they want to have kids, all young girls, moms-to-be, should do a possible, doula training program. But to the understanding that it's a calling.
I think it's also important to understand, even if you're not going to use it as a career, it's good to have all this information, even if you're becoming a mother yourself.
Yeah.
Because you have all these techniques that you can do, and you have someone to support you. So just say you have a sister, or you have an aunt, or someone that's around you in your family, you could help them because you still have this knowledge about. So it's not just a course just to become a doula and say, okay, it's like for any woman or anyone that wants to know about childbirth and the whole procedure, postnatal, everything. So it helps you in all aspects of birth.
Doesn't just end when the baby's born,
Yeah,
eh?
it just doesn't end.
So Sadiyah, what would you say is different to this training course that you formulated, you put together? Because I hear there's acupuncture, there's a holistic approach to it, there's various speakers, there's teaching of breastfeeding, how do you breastfeed? Nobody trains you. They just put the baby on the boob and, off you go. And the nurse comes and checks up on you. Are you okay? Is she latching on,
Yes.
So talk to us about how 15 years ago, of course, you qualified as a doula. And as the years progresses, what changed in times to sort of address this, how you formulated this training program?
So definitely the course that I did 15 years ago is very, very different to the course that we've curated or put together. So for us, it was about skill, the skill work that we're giving off to our students, the know-how on everything. So not leaving anything out where they have to go and do specific courses in order to up their skill. So when I became a doula 15 years ago, I found that when I started practicing or when I certified, when I was qualified, there were so many things that was missing from what I could offer a mum in labor or what I could offer a mum during the postpartum period. So for instance, like infant massage therapy and reflexology. So I had to do a whole course on that. And it's a great skill to offer during the postpartum period where you go in and you massage the baby and you teach the mom and dad how to massage the baby because of the benefits of massaging your baby, the bonding between the baby and the dad and the mom and the dad. And, breastfeeding is such an important thing. It's such an important factor. I wasn't taught that in my course. So I had to do breastfeeding courses during, me certifying or qualifying as a doula because I found going in for a postnatal visit and the mom asks, is my baby latching on properly? And not knowing, not having that skill on having to latch her baby on properly could have easily affected her whole breastfeeding journey. So all of this is covered in our current course, where nothing is left, where the doulas have to go out and then look for other courses to complete. So we've done everything with regard to them having the correct amount of skill and know-how. So when they start practicing as doulas, they know what to do in an antenatal class. They know the type of exercises. They know breathing techniques. And then for the birth, they know natural pain coping techniques, the effects that drugs have on you, interventions, the effects of drugs, etc., how they would explain it to a patient, to conduct a full antenatal class. And then we have postpartum, how to massage your baby, how to bath your baby, how to assist with breastfeeding, how to massage the mum. So it's this whole holistic approach that we've put together, but to make sure that from the time you take on your doula, it's a long-standing relationship. It's not just, okay, I'm your prenatal doula, I've done your antenatal class, and then you can have someone else at your birth and someone else for postpartum. So it's a relationship that starts in your pregnancy right up until your baby is a few weeks old or even months. I have so many patients up to today, and it's so amazing to see these babies grow, where they send me pictures of their kids, at their 10th birthdays and 11th and 12th birthdays, and I feel so old. But I mean...
And you saw them when they were this little.
When they were like that tiny, and, so for me, I think it's a long-standing relationship, and this is why we've equipped our doulas with the skill of taking them throughout the entire process, and not just one, and not just the start, and not just the middle, and not just the end, through the entire process.
Awesome. I want to know what a typical doula training program is. Maybe day one, Doc, you can take us through the beginning bit, the initiation, the introduction, and then Sadiyah, you can follow through with, because everybody's nervous. They're sitting like, what's going to happen? So, Doc, what is the initiation process when one does register? What happens from there?
So we go through everything, what's required of them and things like that.
Yeah.
Fees, everything. So let's get to the first day now of the doula training. So I'll give the introduction, welcome all the students, explain to them what's expected, and about a lot of things about the medical field and experiences. And then Sadiyah will take off with the students and explain to them what's required of them in the course, and speak to them about the course, introduce the course, what they're going to be studying. And also, we go through experiences of why they wanted to become a doula, or why they're doing this course.
Okay.
So you hear a lot of stories, because we just held the course now in in Jan.
Okay.
And then you hear the experiences of why people wanted to become a doula. So a lot of the women were actually, there was like a few older women as well in the course. So to hear their stories is actually amazing, how they still persevered and came to us to do this course now at that age, like in the 50s and 60s.
Wow.
Yeah. And then I had the inquiry this morning about a 69-year-old or something.
Sure.
But she's like, do I have to write an exam at this
That's
age?
the first one they asked.
At this age.
Yeah, that's the first thing they asked.
Yeah.
So a 69-year-old doing a course, sitting there very anxious about this, and that's when I also go back to study. That's the first thing we ask: are we writing an exam? How's the exam? What the questions are going to be? So just to ease the nerves a little bit, what happens on the first day, Sadiyah?
So the first day we discuss certain topics like client-patient liaison, how you conduct yourself, your bedside manner, scope of practice, and everything. Like all our topics are very light-hearted. So in everything that we discuss, I would always share with them, my personal experiences, my funny experiences that I've had, maybe like with doctors or midwives or at births, etc. And I find that people love to share their stories. So I allow all my students to share their experiences with us. So it's different topics that we discuss. And then we do a day like of breastfeeding. We would do a day of natural pain coping technique, where we would physically show the students like acupressure, that sort of thing, acupuncture. And then we have a midwife coming in and speaking about her experience on how to have, how a doula benefited her practice, having a doula at her births that she does. And then we have Dr. Adam coming and, talking about how a doula affects like doctors' practices. And then I also had a mum that used me as a doula for her birth and postpartum care, talking about her experience. And then we had a breastfeeding consult. So it's not, where you're sitting in a class and you have to be diligent and, because I understand these are women, some of them are housewives where they like up and about all the time, doing different things the entire day. So, for them to sit there and just listen to a lecturer the entire day talking about all these different things, can become a bit much for them. So it's very, very interactive. Even with regards to my practical part of the course, I get them involved. I get them to physically come and do the things with me, show me how they're going to do it. So it's lots of fun. It's very, very nice. There's moments where, yes, it does become a bit intense. It does become a bit serious because we touch on topics like infant loss and how to deal with stillborn, how to deal with stillbirths, how to deal with miscarriages, how to support a mom. Because unfortunately, that is the reality of being a doula. You're going to attend births where it's a stillbirth. You're going to attend births, or you're going to have couples where you've seen them prenatally and then the mom has a miscarriage.
Yeah, that's
so
reality.
That's reality. And, there's days like that where we have these topics and you'll find that then suddenly moms will start talking about their experiences and share their real life experiences.
So become a support group, a little
You become
mini
like a
support
little
group.
support group, and which I think it's amazing. It's just women supporting each other.
Yeah.
And I find that amazing things happen when we support each other. And
So
we
much
other.
things happening in that 5 days. Wow. We have to wrap up. We've literally got a minute left. I think, Dr. Adam, if I can ask you quickly, how do you envision the future of doula care, incorporating this training and to better practices of, giving birth?
Well, hopefully we create the best doulas possible and give them the best information and helping all the people out there because that's the most important thing. Especially with the situation now in Palestine, it shows us like we really need to be caring and empathetic and be there for each other because it's really sad what's happening there.
Absolutely. I think, Sadiyah, if I can end with you quickly. I mean, we had reports over 100 women giving birth daily, which means that's happening today in Palestine. And they don't have doulas. They don't have a C-section medication, for instance. I can't even imagine the pain they're going through. Just quickly as a wrap-up, of course, to the doula training and a message with regards to that.
So with regards to that, the stats currently at the moment is 120 women giving birth every day without any medical intervention on their own. It's very, very, it's a very touchy topic for me because being in this field, having to see women birth every day and, how cushioned they are with regards to their births. And every time I attend a birth, I see how lucky our women are that give birth here in South Africa. You can't help but think about what the women are going through in Palestine. And there's, there's some women that are having C-sections without drugs, without epidurals, without spinal blocks. And I cannot for the life of me imagine what they're actually going through or what they're enduring to birth. Because I know what it takes, when they say it takes a village to raise a child or be there for a mom during the labor process. And for these women to have to do this under these conditions is heart-wrenching. And, we make dua for them constantly. Yeah. Also, during my births, I always ask or remind the moms, please remember our mummies in Palestine that are pregnant. Make a special dua for them because your duas are accepted.
So beautiful. Thank you so much.
So inshallah.
Sadiyah. We appreciate those kind words. And to you, Dr. Nabeel, as well. Sadiyah, may this belly to baby doula program grow from strength to strength and enhance many moms to be And let's see some great doulas come out of it as well. Shukran so much to you, and assalamu alaikum.
Thank you. Wa alaikum salam.
Please do contact the Belly to Baby social pages, and we'll leave the details as well on our necessary social pages, and WhatsApp us as well for the details. As we conclude today's episode of Life Matters, we extend our gratitude to Sadiyah and Dr. Nabeel for their visionary leadership in maternal care, their dedication to equipping individuals with the skills and compassion to support birthing families is truly inspiring. Stay tuned for more insightful discussions on Life Matters. From myself, Hawa Solomon, wassalamu alaikum and goodbye.